Welcome back to Wellness Wave Radio. Thanks for tuning in this morning to ride the wave with us. Each week our goal is to give you at least one suggestion that will make your life a little better. My name is Phil George. I'm a clinical biochemist, a certified personal trainer, and a health coach. Please remember, everything we discuss on the show is for informational purposes only and should not be taken as medical advice. Always seek the guidance of your medical professional. So today's going to be a kind of an unusual show. So we're going to talk about the state of American healthcare. And I've been involved in healthcare, pretty much most of my life. So just to back up. So what a clinical biochemist does, I worked in what's called a clinical lab. So my job, my undergrad is in biochemistry, so I understand the theory, mechanism of action, but I also have a degree in what's called clinical biochemistry. So the people in my class, the biochemists, I was basically pre-med, so either they went on to medical school or they went on to research or various things. And one of the things you could do is called clinical biochemistry. So I worked in a lab, in a hospital lab. You came in, God forbid you're bleeding, I'd cross-match your blood, I'd figure out what kind of an infection you have in your throat. So my job was to consult with physicians, doctors, in terms of what's called the pathology or what the problem is. So, and I also train medical students. So my expertise is in interpreting lab work, whether you have it's called the CBC, red blood cell count, white blood cell count. So I did all that stuff. And so again, I've been in the medical field. Most of my friends are doctors, nurses. So right now I've teamed up with Kelly Hamilton. She's actually a ICU nurse over at UMass. In fact, she's sleeping now because I was texting her early this morning. She was working. It was funny because she said to me, she says, all hell's about to break loose. We just got two admissions from the emergency room up there. So, and they're scrambling. So, she's worked at night, so she's going to be, and she's sleeping now. She was a busy bunny rabbit last night. So anyway, my sister's got a master's degree in nursing. She's taught nursing. I guess what I'm trying to say is everybody I know is pretty much medical people. On these shows, in fact, just a couple of weeks ago, we had on it's called a direct primary care doctor, and I think she's a good example of what's wrong with healthcare right now in this country. I'll give you some statistics. America pays the most for health insurance of any industrialized country, but we have the worst outcomes. So what that means is we're paying the most for the worst. So obviously things are not working. The direct primary care that was on the show with me a few weeks ago, she told me that I'm not going to mention where she worked, but she worked at one of the major medical institutions in Worcester, and she said that she had between 2,000 and 3,000 patients. That's a lot of patients. Obviously, she's not seeing them all at once, but you get a bunch of people sick. They're calling in. They need appointments. If you've ever tried to get an appointment with a primary care doctor, good luck. Very, very hard to do. In fact, UMass and the city of Worcester, they're trying to get more primary care doctors. I think they said only about it's somewhere between 2 and 5% of all doctors are primary care doctors because there's not much money being made as a primary care doctor. Most of the money is made with specialists. That's where the money's made. So the other thing with primary care doctors, they have what's called a fee for service. Now, a lot of people believe, I don't believe that's a good business model. So what it means basically, you only get paid for certain things that you do, and that's dictated a lot of times by the insurance companies. So the insurance companies say, we'll pay you to do this, we'll pay you to give a vaccine, we'll pay you to give a drug, we'll pay you to cut somebody's toenails, whatever that is. But they have very specific codes. So, and unfortunately, and again, I talk to a lot of physicians. Unfortunately, with physicians, what happens is so much of it is paperwork now. They need somebody just doing the paperwork because they have to have very specific codes in order to get paid. So, in other words, you come in and okay, good example. They take your blood pressure. That's a code. They put the code in. The insurance company pays them for them. They have a code for this. They have a code for that. But if they don't have the right codes in there, and there's a whole industry now, coding professionals, you hire them, and they can figure out exactly what code to put in. because if it's not put in correctly, they don't get paid. And obviously, everybody would like to get paid for what they do. What they don't get paid for, they don't get paid to ask, again, the physician, and this, you can check this out, they have between 12 and 15 minutes per patient. So I like to call it diagnose and adios. They're going to give you a diagnosis that goes in the code, diagnosis, hypertension. Okay, other thing interesting about hypertension, most hypertension is what they call idiopathic. What idiopathic means, they don't know. So many diseases are like that, they don't know. They have no idea what's causing it. I'm a dues-paying member to a group called Root Cause Practitioners. So as a biochemist, I just don't want to throw a drug at something or a procedure. I want to know what's the root cause of the problems. What's causing the high blood pressure? Is it too much salt? Is it too much stress? Are you eating the wrong diet? More than likely, because most Americans are. So as a biochemist and a health coach, what I do is I want to find out what the problem is, and let's fix the problem. Let's throw a drug at it. Good example, if you had a melanoma on your skin and it's got this huge bump there, we're not going to put a Band-Aid on it and ignore it. Say, oh, well, at least get the Band-Aid off. Or if you're bleeding profusely, you don't just put a tourniquet around you and stop the bleeding. You want to know what's causing the problem. So as a health coach, that's what I do. Actually, interesting, I teamed up with my friend Kelly Hamilton, ICU nurse. She's also a holistic nutritionist, and obviously that's really important, because even though you have certified nutritionists after your name, if you've been, in fact, I had a relative that was in a hospital. She was very health conscious, and she said, "You won't believe the crap they gave me in the hospital. It was, they're giving you all kinds of stuff. Look at schools, what schools are." But these are all run by certified nutritionists, okay? But they have to follow the playbook that the government gives them. So they're giving people in hospitals, schools, nursing homes, the garbage they give people. In fact, it was interesting. I visited a relative that was at a nursing home, and she was obviously obese. You could see she was obese. She had what's called COPD, chronic obstructive pulmonary disease. She had stuff, oxygen tanks on her and everything else, and she was huge. And I saw, visiting her, I saw her on a table. They had given her like a candy bar, like a Mars bar or something. I mean, it's crazy. You don't give an obese person candy. That makes no sense. But they do this. They do this in a lot of places. They give you garbage. So, again, I teamed up with Kelly Hamilton. In fact, we're doing a seminar this coming Sunday at Route 12 Pickleball, and I think it's 184 West Boylston Street in West Boylston. But email me, philgeorge@charter.net. This week's show, we're going to be doing it on cholesterol and statins. In fact, when I give the seminars at the Senior Center right here in Leicester, I was going to do something on magnesium, but so many people in the audience asked me about statins that I changed my whole seminar over to statins. Statins cause a lot of problems. If you have a lot of aches and pains and you want to know why, and we can help you with that, come to the seminar. Email me, philgeorge@charter.net. I'll send you the information. In fact, we have a lot of sponsors. We give out a lot of free stuff. New Kitchen is one of the sponsors. We give out gift cards. In fact, if you email me, philgeorge@charter.net, and come to the seminar, we'll give you a $5 gift card to New Kitchen. I'm an affiliate with a lot of different companies, so they give me free stuff. So I have like bone broth, and we put in the back. Just a heads up, we do charge $10, because unless you pay something, it's not worth anything to you. But I can almost guarantee you'll walk away with more than what you paid, hopefully in education, and make your life a little better. And if you get aches and pains due to statins, come to this. I'm going to explain to you why you have the aches and pains, and I'm going to explain to you how to take away those aches and pains. But if you know somebody that's taking a statin, statins right now are the most prescribed drug in the country. So everybody's on a statin because they're telling you your cholesterol's too high, your LDL, the bad cholesterol. That's not true. Your HDL. I'm going to go into a deep dive. I got cute slides on there. It's very understandable. In fact, one thing people say they like about me, just one, is that I make very complicated subjects understandable. I got cute pictures with cartoons and stuff. So you'll walk away. I'll throw the fancy words at you, but those fancy words will mean something to you. So if you hear those words again, then you'll know basically what it is, and you'll understand What I hope to do when I meet with clients or when I do these seminars is to really educate you, because the whole point is that, what's the old expression? Instead of giving a man a fish, you teach him how to fish, and and he can do it forever. So what I do is, when I have clients, the first thing I say to my clients when I sit down with them, I say, my job is to have you fire me as quickly as you possibly can. I don't want you as if I have you as a multi-month client, then I'm not doing my job, because I'm not educating you. I don't just tell you, eat this, eat that. I tell you why that is, and I explain the mechanism of action of why those things happen. I'm also a certified personal trainer, and so what happens, instead of having one person that's a trainer, you're paying them. You got one health coach, you're paying them. You got basically, I deal with people too in just terms of psychological stuff going on. In fact, I'll give you a real life example. I teamed up. I go to two gyms. I go to Planet Fitness at Webster Square, and I go also to Crunch Fitness over at Millbrook Street. So, and I have friends there. Anyway, the head trainer over at Planet Fitness, fortunately, he knows he doesn't understand really nutrition, because they'll just tell you, go to the government website. So he sends over his clients to me. He trains them, but I took care of the nutrition component. So I got this relatively young woman, maybe in her early 30s, Brazilian girl, beautiful girl, great shape, everything's wonderful, but she wanted to dial up her nutrition. So we sat down across from her, and a couple of minutes into it, and I said to her, you know what? I said, your problem, Maria, your problem is not really the diet. Your problem is you're stressed to the nines. I can see it on your face. And she said, that's odd. She says, because I came down with shingles a couple of months ago. So with shingles, basically, the way shingles happen, most everybody's had chicken pox somewhere down the road. So that's basically a virus that stays inside of you, and everybody has it inside of them all the time. It's just like the Epstein-Barr virus that causes mononucleosis. I had that. That stays in your body all the time. What happens with your body, if it's under a lot of stress, what happens, it shuts down your immune system. So your immune system is basically in hibernation. When the virus or a bacteria that exists in your body knows that, this is the opportunity for them to come out, because you don't have your shoulders, your soldiers attacking these things. All your macrophages, they go eat these things up. They're not attacking them. So stress is one of the reasons why a lot of people get sick. A girl in her 30s shouldn't be coming down with shingles, okay? It usually happens in an older person. So she realized that. She says, in fact, my husband is telling me I come home and I'm bad mood. She kicks the dog and stuff like that. So a lot of the seminar I dealt with her nutrition. A lot of the seminars was to give her techniques and tools to come down with the anxiety, with the stress. So again, this is something that we do. So if you're interested in coming in and and having a coaching session, email me philgeorge@charter.net. I team up with Kelly. I do what's called I do basically all the lab work part, and Kelly will do the nutrition part. So you get 2 for 1. You get an ICU nurse, you get a holistic nutritionist, and you get a biochemist. And a personal trainer. 3, you get 3 for the price of 1. So email me philgeorge@charter.net if you want any information on that. But let's get back to the problem again. America pays the most for health insurance. We have the worst outcomes. I just saw in the Telegram and Gazette 3 days ago, insurance companies are losing money. So they're saying they're planning on raising rates starting in 2026, another 14%. You guys, if you pay for your health insurance, you know how expensive that is. The other problem is they're raising all the co-pays right now. So what's happening is not only you're paying a fortune per month for the health insurance, it probably takes you 3 months to see a doctor. God help you if you've been to the emergency room. It's 6-hour waits in the emergency room. I've heard this from clients over and over again. You're sitting there and they got the stretchers, back to back. You're like an airplane on a runway, just waiting, and they're just moving you around. Nurses are overworked. I know nurses. Doctors are overworked. Unfortunately, again, nurses talk to me all the time. what happens, you go in yourself, you go in with a loved one, and you're obviously you're very concerned with your loved one. They've got medical issues going on, and otherwise they wouldn't be in the emergency room. So what happens is they get upset, and the nurse is walking around taking your blood pressure and stuff like that, and they start yelling at the nurse. Don't yell at the nurses. It's not the nurse's fault. Okay, they're overwhelmed. They've got way too many patients, and so many people are sick now. So we have a whole sickness epidemic going on. Everybody's sick because most people are overweight. They have what's called metabolic syndrome. Even if you wind up having and one of the big problems now for younger people is basically colorectal cancer. Big deal. So what happens, I've had clients, and one of the ways you can check for colorectal cancer is called occult blood. That means hidden blood in your stools, and there are tests for that. But if it's really bad, you could wind up actually seeing blood in your toilet bowl. That's a problem. And even though that happens a lot of times, I've talked to clients that still had to wait months to get a colonoscopy done, which you can see if they actually have it. And with cancer, the sooner you treat it, the better. So again, the hospital system is overworked right now. The other issue is you don't have much choice. We only have two major health providers in this country, in Central Mass, and that's basically UMass and St. V's. Nothing bad about them. But they're eating up all the Marble Hospital. They're all going into one big thing. So if you don't like one hospital, there's really no place to go. You have one. You really have two places to go. The other issue right now, what's called allopathic or Western medicine, is something called a standard of care. So what a physician has to do, they have to follow what's called standard of care. Good example. So if you go in and your cholesterol, let's pick a number, is 300. They're kind of required to put you on a statin. They're not going to ask you your diet. They're not going to ask you about your exercise. They're not going to try to necessarily fix the problem. They don't have time. They got 12 or 15 minutes. The playbook is your cholesterol is X, statin. Your blood pressure is this, high blood pressure med. Whatever it is, they have basically, they'll have a drug for it. There's a drug for every ill. It was interesting because, interns, medical students, when they're going through there, they have those big white lab coats and the big pockets in them. In those pockets is a thing from a drug company, let's say Pfizer, okay? And they look up the ailment, high blood pressure, and they see all the drugs over here, okay? There are natural ways to lower your blood pressure. Again, this is what I do. I'm a health coach, I'm a biochemist. So, and the other problem is with drugs. I had Donna Bartlett. She teaches pharmacy. She's a pharmacist, teaches pharmacy at Mass School of Pharmacy. I had her on the show several times. She's sitting right here. And she said, basically, she calls it polypharmacy. I love to call Donna the anti-pharmacist because she tries to get you off the drugs. She tries to go back and sit with you. In fact, if you're on a ton of drugs, Donna will do a consult with you for a fee, of course, but it's pretty reasonable. I think it's like $100 or something. And she'll sit down with you. Because the other thing she mentioned, a lot of, I looked this up, in fact. Physicians have had maybe one or two courses in biochemistry, okay, which is the root cause, understanding how things work. The other thing, they, again, had maybe one or two courses in pharmacology. So pharmacists know this is their business. They know this stuff. So if you're a gastroenterologist, you're dealing mostly all the time. If you got any kind of IBS, or irritable bowel syndrome, Crohn's disease, stuff like that, they have drugs for that, and that's what they're used to. They know this drug goes for this, drug goes for that. But they're not a cardiologist. Cardiologists know about basically drugs for the heart. They know drugs for the heart, but they don't know the other stuff. So you could be on drugs for IBS, and you could also have a heart condition, or you could have high blood pressure. All those drugs can interact. Donna said, and you can look this up, the average 56-year-old are on between 5 and 6 meds a day. That's a lot of meds. The other thing, and I can't speak for Donna, but the other thing is what happens is they're very reluctant to take you off a medication because they can get into trouble. So Dr. X ordered these three drugs. Dr. Y ordered these 3 drugs. Dr. Y is not going to want to mess around with Dr. X because they don't really know. It's safer for them just to leave you on this stuff and hope for the best. but I think you all know there are all side effects to drugs. And Donna said that. Whatever drug you take, there is a side effect. And drug A may not affect me, but it could affect you. Because I'll get a little bit into genetics now. What happens with genetics, we have something called a polymorphism, fancy word, or called a SNP. All it means is that you have certain genes, these microgenes inside of you. Basically, that means that you don't metabolize a statin the same way as somebody else does. So that statin caused you a lot of problems, but it may not cause somebody else a lot of problems. So again, that's the issue. Everybody reacts differently to drugs. Okay, like I'm 79 years old. I'm on 0 drugs. Okay, 0. Okay, and I'm going to try to keep it that way. But I do a lot of supplements. I do a lot of things like that. But supplements are a tricky business. A lot of these are made in China, India, no quality control. So if you have supplements and you want a consult, I'll give you a free consult on the supplements. And you may be taking a good example. People come to me all the time with different type of either supplements or energy drinks or whatever. And one of the things in almost a lot of these supplements or energy drinks is something called B12. Now B12, a lot of people are deficient in B12. It's kind of like the energy vitamin. It gives you energy. So a lot of people will put that in various drinks and stuff like that. B12, taurine, these are all types of things. So when a client comes to me and I look and they say, is this supplement or is this drink or is X any good? The first thing I look at is B12. And people think B12, all B12 is the same. It's not. There's different forms of B12. So what I look at, in fact, when I did the seminar, people brought in their supplements and I said, look down at your B12 and see what's in the B12. There's 2 forms of B12. One of them is called cyanocobalamin. Okay, cyano like cyanide. Cyanide's not good. Other one is called methylcobalamin. So I challenge you, go to your supplements, look up your B12, and see if it's cyanocobalamin or methylcobalamin. In fact, I've got a radio show, WCRN. In fact, if you type in Wellness Wave Radio in any of your browsers, I'll pop up. I've got YouTube videos, I've got podcasts. It actually now, this show, all shows, this is going to be on YouTube. All shows are syndicated. Actually, it's worldwide now, but it's definitely nationwide. It goes all over the place. You can just type it in. So people call me in from the radio show all the time, and they have questions. And I brought up the B12 thing, methylcobalamin, cyanocobalamin. And I said, go over to your supplement, look it up. What's in there? Cyanocobalamin. The reason they use cyanocobalamin because it's much, much cheaper. And they realize people don't know the difference, okay, unless you look at the ingredients. A good rule of thumb, what's called a heuristic, which means a general way of looking at things. Anything with methyl before it it's called methylation. In other words, your body can absorb it. It can use it very, very well. So look up for the methyl, like methylfolate, as opposed to folic acid. Unfortunately, with pregnant women, they'll put them on folic acid, which isn't as bioavailable, and your body may not be able to use it very well. So even though you think you're taking these supplements, in essence, this may not even be you might not even be absorbing it. So again, you may just be pooping or peeing it out. So you have to know this stuff. Again, I got my buddy Kelly, and she does the stuff I do. So if you want a complete kind of overhaul of what's going on, and you want to do a reset, then email me philgeorge@charter.net, and we'll do an intro, a free intro, and talk to you, or come down to the seminars. The other problem is it's such a big problem now. Seeing a doctor, seeing a specialist. I like to say you've got to be the CEO of your own health. You got to take care of yourself, take care of your wife, your husband, your kids. The other thing, I think it's money well spent if you spend some time with me and Kelly, because what will happen is you'll get an education. If you go to college, you're going to spend a ton of money going through this whole thing. So not only are we going to hopefully make you healthier, and I want you to fire us as quickly as you can. The other thing is you're going to understand this. So you can help your spouse, you can help your kids, you can help your mom, you can help your dad. Because if you think about it, knowledge is really, really, really important. I read in terms of self-help books and stuff like that, anything you can do that increase your knowledge base makes you more valuable. And if you think about it, your health is the most important thing. The two most valuable things you have are your health and your time. And I think health is even more important, because even if you had a lot of time and you're miserable and you're sick all the time, you may wish you had a lot less time. They found out that the last 5 to 10 years of people's lives is spent in infirmity. My relative is in the nursing home now. I mean, I told my wife, if it happened to me, give me an injection. I want out. I don't want to live like that. This poor woman, she's got oxygen tanks. She can barely read. She's coughing. She's got COPD, coughing her brains out. At one time, she had a normal weight. Now, because of all the drugs she's taken and everything else, and all the crap food they're feeding her, she's obese, which is going to make things work, make her even harder to breathe. Now, this stuff, you're getting sick, coming down with cancer, coming down with COPD, coming down with metabolic syndrome, high blood pressure. This doesn't happen overnight. This is something that's accumulated over a period of time. Big thing now is what's called insulin resistance. And all that means is your body is not able to metabolize sugar very well. The other thing is a clinical biochemist, very few people order what's called a fasting insulin. 10 to 20 years before you come down with type 2 diabetes, your insulin levels are through the roof. I've got to explain it. Most people know about a fasting glucose, right? And they say it should be below 100. Okay, so let's just imagine a railroad track. So let's say your fasting insulin is 100, just to pick a number. That's called pre-diabetic. Your doctor's going to say, watch out for this stuff. But what happens, a little bit of biochemistry, what insulin does, insulin will basically, it takes the sugar and puts it into your cell. So as long as your insulin, imagine a railroad track, as long as your insulin and your sugar pretty much stay the same, you're fine. But what happens is, as people eat the standard American diet, insulin goes up and up and up to keep the glucose at 100. So, but you don't realize that. You see your sugar still being the same, but your insulin is screaming at you, you know what, I can't deal with this anymore, because your blood cells become insulin resistant. The sugar can't get into it because the insulin has worn it out. So again, what I do with clients, I look at their lab work and then I say to them, your doctor's not ordering this in lab work. Another quick thing, not many doctors order this. It's called a high sensitive C-reactive protein, and that just means it measures your chronic inflammation. David Sinclair, one of the top anti-aging researchers out of Harvard, this came out just 2 days ago. He said if your A1C, hemoglobin A1, not hemoglobin A1C, if your high sensitive C-reactive protein is above a certain level, above 2, it doubles your risk of a heart attack. Okay, so these are warning signs. You can't change what you don't measure. But again, I'm assuming most of you guys out there are not biochemists or ICU nurses, but this is what we do. So we're coming up to the end of the show. Again, feel free to email me, philgeorge@charter.net. Thanks for tuning in, guys, and we'll see you next week. One of the most common questions I'm asked as a biochemist and health coach is, what are the best supplements to take? Choosing supplements is a tricky business. Many companies have poor quality control and questionable ingredients. In the past, I had to send clients to several different websites. I am now able to offer one-stop shopping for all the quality brands I recommend, with no shipping cost and a lower price in most cases. Just email me, philgeorge@charter.net, for a free consult.